You know what they say on TV. Push one of Epi's stat.
Yeah, nobody actually says that.
Exactly. Welcome to the real world of nursing. I'm Millicent Olulade, better known as Nurse Millie.
And I'm Nurse Tara.
And we're surviving 12-hour shifts, nonstop call lights, and pure hospital chaos.
And each other.
This is Shift Happens, where we talk about what really happens on and off the shift.
Hello, everyone. Welcome back to Shift Happens podcast. Thank you guys for tuning in. Today we are talking about money talks. Are nurses underpaid? So our first section is chief complaint. So the purpose of a chief complaint for all of you that are not in healthcare is to introduce the episode topic, explain why it matters, and present the central question the episode will answer. Our chief complaint today will be, I'm responsible for people's lives, but does my paycheck reflect that responsibility? Nursing is one of the most trusted and demanding professions in healthcare, yet many nurses question whether their compensation truly reflects their education, responsibility, and emotional labor. Today's question is, are nurses truly underpaid, or is the real issue something bigger than salary? Tara. I want to hear from you. I want to hear from you.
The purpose of the Shift Report is explore the topic through personal stories, experiences, humor, and honest conversation. Millie, do you think nurses are underpaid? Why or why not?
I definitely think that nurses are, I feel like I'm in a beauty pageant. I definitely think that nurses are underpaid. I don't know about now because I feel like since COVID happened, healthcare administrators have appreciated the labor of nurses. So I think nurses are getting paid way more, and there's also way more travel opportunities for nurses to make money. When I initially started off in nursing in 2012, my first salary or my first rate per hour was $19.37. I did not know that. I had kind of gone into nursing, obviously loving what I was going to do, but I was like, okay, it's great. I'm going to get to do what I love and be compensated appropriately. Honey, I used to work at Walgreens as a pharmacy technician, and I made $14 an hour. So you telling me I go back to school to get another degree because my biology degree didn't afford me just a traditional job. So I had to go back to school. So I'm like, at least it'll be worth it on top of having to pay for student loans. And now you tell me I'm making $19 an hour? What are we doing here? I got to pay student loans. I got to get my Mercedes SUV that I had dreamed of, and I need a place to live. So my big dreams of balling were cut short. I was sitting on the bench. So yeah, I definitely think that nurses are underpaid for their work. You stay 12 hours. You're dedicated to the patient all day. You deal with the complaints, the craziness, the chaos. It's a lot. And that's why I always tell our young nurses or people that are potentially interested in doing nursing, you have to love what you do. Because you can't necessarily do it for the money because it will get old very quickly. What are your thoughts, Tara?
Yeah, I think they're underpaid.
Is that why you did CRNA?
I did CRNA. No, not for the money, really. I didn't know that there was so much money in being a CRNA because I would say I was making way, way less when I started in 2010 than I am now.
Okay.
But I love what I do. And really, I like working hard. I've always had 3 and 4 jobs, even before I was a nurse, as a RN. Yep. And now I have 3 and 4 jobs. So the money really is a side effect.
Right.
Because I really love the effect I have on patients and working with my coworkers and doctors and other nurses.
It makes it easier to go to work.
Yeah, it makes it easier. But I definitely feel like at the end of the day, it's a job. Some people get so offended when people talk about money as it relates to nursing and other healthcare workers, but we're nothing. I mean, we're like a garbage man. Everyone should be compensated.
Right.
Or a
teachers.
Yes. Everyone should be compensated for what they do. So everyone's in it for a paycheck at the end of the day.
You gotta pay your bills.
You have to pay your bills. So you just have to look at it like that. But I love what I do, and the money's great now, and I work really hard. I work a lot.
Work hard.
But Millie, tell us about a time you felt your workload didn't match your paycheck.
Ooh, Girl, it was one shift. I had a patient with a GI bleed. And this was when I was making $19.37. The doctor asked me to do an enema. It was like in a pail, like an actual pail, and you put water in it and then you run it from gravity and to the patient. And so Miss Lady was having a hard time getting out of bed to the bedside commode. So I was having to help her back and forth. So she was kind of wobbly. She's like, oh, it's coming. I'm like, come on now, let's hurry up and get on this potty. She didn't make it. Do you know that all of that blood and feces came out onto my socks, my shoes, and my clothes? And I did not have a change of clothes. I had never had to do that.
What time in the morning was it?
Girl, it was like 10 o'clock.
Still early.
It was 10 o'clock, and I just had to stand in that. And if I had known before what I was getting myself into, then I would have, come with extra shoes or socks. But that was the first and last time I had to do that. So at that moment, I was like, you know what? Am I in the right field?
Right.
This is absolutely disgusting, like horrible. And then I told the GI doctor when he came in, he's like, how did it go? You had to do it 3 times. I said, look at this. He was like, oh boy, I should have told you. So yeah, that was definitely a time that I remember. Tell us about a time you felt your workload didn't match your paycheck. So Tara, do you think travel nursing changed the profession for better or for worse?
I think travel nursing has definitely changed the profession, and I think it has for better. Everyone is the same. I don't know why everyone has their panties in a bunch. Oh, you're a traveler? This is the deal. A traveling nurse and a staff nurse are the same, right? The staff nurse gets vacation. The staff nurse gets health care. They're the same. So it's just a little bit off a balance. But if you want to do traveling, everyone can do traveling. But the thing is, with the traveling, you don't get health care. You have to pay for it on your own. For my malpractice, I have to pay for my malpractice. If I don't work, I don't eat. So it all balances out. And I feel like traveling is great for nurses that want to go in areas where there's a need, and that helps with staffing. And just travel the world and maybe go somewhere like Hawaii where it's really expensive to live and they're able to travel and make maybe not as much as they make in a state that needs more nurses, but just able to work and experience different things. I think it really works out great for keeping that peace we talked about.
Yeah. Well, hold on now. You talking about panties in a bunch? Who has their panties in a bunch about it?
Like the staff nurses, they get really mad because
you're making more money.
So they're making
to do
way
the same
more
thing
money,
they're doing,
right? But they could do it.
Yeah.
But that's what I'm saying. It's a balance. So while the travel nurse is like, there's times where maybe they don't have a contract, so that's 2 weeks where they may not get paid. But the staff nurse, they're always going to get like paid time off or sick leave. So I feel like it all balances out, and we need nurses. Sometimes there's strikes, and we need nurses to pass the strike line and actually go and provide patient care, because ultimately, if we don't have nurses, who's giving patient care?
I also think, and you can correct me if I'm wrong, when you're a travel nurse or a float nurse, they intentionally give you high acuity patients. Is that true? Because they're like, why? I'm going to take all the easy patients today, since you want to come here and make $80 an hour. We're going to give you all the hard patients.
Well,
would you say you witnessed that?
Way, yeah.
Okay.
That maybe the travels nurses feel like they're dumped on. But if you're in a good facility, you try to take care of your travelers and maybe not shit on them, because they're there to help.
Yeah.
Now, Millie, if you could change one thing about how nurses are compensated, what would it be?
Ooh. If I could change one thing, I feel like raises should be better. Again, I don't know what they're doing now in hospital facilities, but there was a hierarchy of how much of a raise you would get. So I think the highest was 25 cents a year. And then the next tier was like 15 cents, then 10 cents, then 5 cents. And then tier 5 was like no raise. So your raise was based on your performance. The manager would go through whatever she would go through and then determine what tier you felt on. how do you know what I'm doing at work? If we all showing up at the same time, getting our work done, have high patient satisfaction scores, how do you rank who's the better nurse? It also creates disdain amongst your coworkers and colleagues. And lastly, it almost comes down to favoritism. So as I was a new nurse and I always got the 5-star. And then the nurses that had been there for a while that I also feel like did just as great of job as me, they would get no raise or be on a level 1. And it's like they start looking at you funny and the whispers go, what tier are you on? What tier are you on? So you going to get the 25-cent raise? Oh, I'm getting the 5. I didn't even get nothing and I've been here 20 years.
Wow.
So I feel like it should just be an even or level playing field on raises. Now, how that's calculated, I don't know. Maybe it's based off patient status. Maybe it's based off the bonuses that the hospital get. But then you have MDs coming in or other mid-level workers like respiratory therapists. Everybody's going to want their raise. So I get it. I don't know how it would work, but I would just suggest a better salary increase or raise increase. Tara, besides money, what benefit or workplace change would you make to show the biggest difference of nurses?
Besides money, listen, girl, money's all that matters. That's how I love money. You got to throw it. I feel like I'm at the strip club. So,
girl, do you see that fly over there?
Put the money down, Millie. So money is the ultimate. So I feel like you have to pay people and you have to pay their value.
Yes.
But another thing is a good work environment. You don't want to be around a hostile work environment. You want a great patient load. I don't work in the floor anymore, but I don't want to take care of 6 or 8 patients that are very, very sick. And when that's not the, appropriate and safe ratio. And your lunch breaks. You should be able to get an adequate lunch breaks. Those are some things I think. But again, that's why to throw that money. Money is king.
I think also too, and let me tuck my bills there. I feel like we have such a high turnover in nursing because we're burnt out, and the pay does not reflect that.
Yeah.
So you will invest money in orientation, training nurses, hiring nurses, and then you don't treat them well. So you have all these nurses quitting, then a new batch comes in. And so it's important to retain the nurses you do have. Because when I was a nurse, it was always new nurses because all the old nurses are leaving. Like, this job, they don't take care of us. They don't care about us. We don't feel protected. We don't feel supported.
Yeah.
And then they leave. So now you have all these new nurses training new nurses where we lost all the good old nurses.
Well, Millie, let's go to the nurses station while you gather up that money.
Okay.
So the purpose of the nurses stations is to engage the audience through anonymous admissions, listener questions, scenarios, and advice.
So what's our anonymous admission today?
I love being a nurse, but sometimes I wonder if I'd make more money and have less stress doing something different.
I've definitely heard some of our friends say this. And thank you for leaving that anonymous admission in our Instagram DM. Whenever our nursing colleagues are asked that question and they respond, because we've all had that conversation. I think you said you would be a stripper and I'd be a rock star.
Right. I love making it rain.
Everybody is like, you know what? I would love to do this, but I'm not going to. I went to school for this. I'm still paying loans for nursing. What else am I going to do that is stable, that has some stability? Healthcare and education, there is always stability, even if you are underpaid. So I feel like most of them are like, I would like to do this. I hate my job, but I'm stuck.
Yeah.
So then I will recommend, hey, what about trying a different specialty or a different field in nursing? Because you do get burnt out.
Well, I know some people that felt that way and they changed their whole trajectory of a career and they just do something totally different. So sometimes that's good advice, is to try a different niche. But a lot of times people just totally get out of healthcare because they just don't like it. But I feel like money, if you're getting paid enough, I feel a lot of people quit and they'll go somewhere else because they're not making enough money.
True.
So I feel like money is really good. One of the listener questions, Millie, is if you could instantly improve one thing about nursing, what would it be? higher pay, better staffing, better management, or better work-life balance? Why?
That's easy. All of the above. Right. That is how you're going to retain nurses. The hospital was not going to lose money. And then when your nurses are happy or your physicians are happy or any of your staff is happy, then your turnover is less and your patient satisfaction scores increase, which makes the hospital money.
Yeah.
What do you think?
I think work-life balance is really coming into play, especially with a lot of the younger nurses, those millennials. They really are not like us. They're not going to work. They're really going to enjoy their time. They're taking their trips, and they will go somewhere balling on a budget as long as they're going and taking their trips and having their self-time. So I feel like the work-life balance is really becoming very important to make sure that you're not just at work all the time, that you do have some life to live.
Agreed. We are going to address the diagnosis, answering the chief complaint by sharing the biggest truth or takeaway from the discussion. Nurses aren't just asking for higher pay. They're asking for compensation that reflects the responsibility, the skill, and emotional labor the profession requires.
That's important.
Yeah, and it's reasonable.
Yes, because salary is only one part of the equation. Staffing, leadership, safe working conditions, and respect often determine whether nurses feel valued.
I want to address that. Might make some of these physicians mad. Physicians, not all, but some feel like I've overheard them saying that, why do nurses need to make more than what they make? You only went to nursing school. We went to medical school. We went to residency. We went to fellowship. So we're being compensated for our education. Nursing school or nurse practitioner school, you have like 500 clinical hours where we have 5 to 7 years.
Right.
So what are your thoughts about that?
I work with this doctor all the time, and he wants to be a CRNA so bad.
Why?
Because he's like, Tara, I love your life. I say, you should have been a CRNA. And I feel like maybe they question, well, why do you need to make more? Because of the education. But maybe they don't quite understand just exactly what nurses do. Like, they run the hospital. At night, in the ICU, it's the nurses. There are no doctors. Yeah, you have your hospitalists or the anesthesiology fellows that come in and call the codes or run the codes or call the deceased. But the nurses are really running. So I feel like they maybe don't respect just the level that nurses are running shit.
I think it comes down to a liability issue. Like, if something is misdiagnosed or whatnot, then we are liable for that patient. We take more of the responsibility if something goes wrong. More than likely, we'll be named in the lawsuit versus the nurse or another mid-level. And they also have a lot of student loans to pay back. And just, observing my husband and what his colleagues do every day, it's very stressful for them too. Because nowadays, healthcare is just overwhelming. Like with the charting, the acuity, people are definitely more sick these days, and they want an instant cure by a pill rather than doing the work. Let's go ahead and discuss the treatment plan. So the purpose of the treatment plan is for listeners to leave with practical advice, encouragement, or actionable steps. Know your worth. Advocate for yourself. Negotiate when appropriate. Pursue opportunities that align with your financial and personal goals.
Don't compare your career to everyone else's. Choose a specialty and work environment that best fits the life you want to build. That's what we're talking about, working in your niche. That's why I love it. One job I work, we work where we enjoy it. So maybe someone likes working with a particular neurosurgeon. They always put them there. I like working with this one doctor, the one that wants to be a CRNA. He's so funny, but I love him. He's excellent. And not everyone likes working with him. I don't always like working neurosurgery or working orthopedic surgery. But if you work where you like, why would you put me where I'm like, oh, I hate this? Why would you say, well, you have to do it if someone else enjoys it more?
Yep.
So you should work in a specialty that really you like working in, because it just makes it better and you feel like you're getting valued.
Let me ask you one question for the new nurses or the timid nurses. How would you, it's kind of awkward when you try to advocate for your pay, especially as like an RN. What is your advice for that? Like, have you ever negotiated your pay as an RN or as a CRNA only?
Yeah, I've negotiated as a nurse with experience because I feel like with the experience. So one thing about when you graduate as a new nurse, yay, you graduated. And just learning, that should be the focus then, because the money will come and the experience will come. So my advice for a brand new nurse is you'll get that experience and then you can negotiate more because you have more of a skill set and you're better valued. So I think in the beginning it's just not always about maybe negotiating. It's just about learning.
Yeah, you're there to
and
get
see
your
what you really
experience.
want to do, because some people start off in the ICU and they hate it, and then they'll come to the operating room and they've had the experience, so then they can come and say, well, I need this amount. Like you said, look and see what your financial and personal goals are, and they like it better. There's not a lot of night shifts, and they're working a normal shift, and they just like this work in the operating room is much better. So the discharge instructions, the purpose of that is to end with the one memorable message listeners should carry with them.
If listeners only remember one thing, nurses deserve to feel valued, not just with words, but with compensation, support, and respect that reflects the work they do every day.
One clinical pearl. The purpose is to finish with a brief educational tip, nursing concept, or medical takeaway.
I want you to tell me what a compensation package is, because
Okay,
the way you're throwing these dollars, I know your compensation package is beautiful.
It's fat.
Is it fat?
It's obese.
P-H-A-T?
It's obese. The definition is the total value of your employment, including salary, benefits, retirement, paid time off, education assistance, shift differential, and bonuses. In plain English, your hourly wage is only one part of your job, of what your job is worth.
And that's where we talk about the balance.
Yes.
Well, thank you guys so much for tuning in to this episode of Shift Happens. Please leave us some anonymous admissions or questions you have on our YouTube comments, Instagram DMs, TikTok DMs, and please follow and listen to us on Shift Happens Podcast, Apple Podcasts, Spotify. And while you guys are clocking out, I'm going to stay after because I have to chart. But really, I'm just going to steal all these ones because I'm just a nurse practitioner. I ain't no CRNA working 80 days a week. So sometimes we got to do what we got to do. Okay, thank you guys.
Get that money.
I am.
All right, that's our time. The charge nurse is already looking for us. Thanks for working with us.
And if you enjoy the episode, make sure to hit subscribe on Apple, Spotify, or wherever you listen.
And follow us at Shift Happens on Instagram, TikTok, Facebook, so you don't miss the chaos. I'm Nurse Millie.
And I'm Nurse Tara.
Please don't hit the call button. We are clocked out.